Naruvi Hospitals, promoted by the Sanko Foundation, is the brainchild of the founder-chairman Dr. G.V. Sampath. Belonging to Vellore, the medical hub of India, Dr. Sampath's vision to create a medical destination for the people of Vellore in particular and others from India at large and also overseas resulted in the establishment of a hospital here, a real crown jewel in the field of healthcare. Large numbers of people belonging to Vellore and the surrounding districts have been known to travel to Chennai and Bengaluru, both nearly 200 kilometers away from Vellore, seeking medical care due to the dearth of facilities and the hardships faced by the locals to access available services. As per the vision of the chairman, the best in healthcare, both in terms of medical and nursing professionals as well as sophistication, were infused into the institution, making sure that patient affordability was addressed at all times. Less than a month after Naruvi Hospitals opened its doors to the public, the second wave of COVID loomed large as life. We took on the challenge and quickly rose to the occasion, catering to the local population and some from outstation as well, adding close to 40 critical care beds and over 200 ward beds to the COVID care pool. Much as it was hard for a 1-month-old hospital to handle such large volumes of very sick patients, Naruvi Hospitals was able to contribute significantly in our country's efforts to save people from the disastrous end that COVID was driving people to. Naruvi Hospitals is positioned as a high-end tertiary care center. Our focus on ethics, transparency, patient satisfaction, and an academic outlook in everything we do ensures that doctors, nurses, and others in the care team are performing at their conscientious best to not only treat patients' ailments, but also to make them happy overall when they leave our hospital. We have tied up with the Henry Ford Health System, HFHS, based out of Michigan State in the United States of America. HFHS is one of the old and leading healthcare delivery systems in Midwestern America. The main aim of this tie-up is to have constant transfer of knowledge and to get access to the time-tested practices they have been following for decades, which ultimately translated to patient care. Naruvi Hospitals is a completely paperless and filmless hospital. The Naruvi philosophy of care is embodied by our motto, Fragrance of Care. The doctors in Naruvi are largely trained in the best of medical institutes in India and come with years of rich experience in their fields of expertise. With the philosophy and its pallbearers, the medical and nursing professionals, the high-end equipment, and the building infrastructure complete the holistic picture of Fragrance of Care. The hospital is 475 bedded with a 25% critical care bed count. Naruvi Hospitals boasts of an over 5 lakh square foot building spanning 14 levels. The building is completely air-conditioned, conforming to ASHRAE standards with zone-specific air conditioning to reduce cross-infection between different care areas. Our laundry is 100% barrier washed. We have a top-of-the-line sterilization department with machines with 95% water-saving machines, saving up to 300 liters of water every running hour. We have all the major medical and surgical specialties. There are 16 modular operation theatres with laminar airflow. All the equipment in the ICUs and OTs are pendant mount to avoid clutter on the floor. All the departments are equipped to the most modern standards with the best and latest equipment so as to be able to provide the best end-to-end treatment to our patients. State-of-the-art cardiac cath labs, the latest robotic hybrid OT, ECMO, interventional pulmonology, high-end orthopedics, general and bariatric surgery, epilepsy monitoring unit with robot-guided epilepsy surgery, neuro monitoring, navigation, the latest lithotripter, urology laser are just some of the arrows in our quiver. Our primary focus, though being the local Vellore people and Indians at large, we are working towards attracting overseas patients as well. We have started an office in North Sudan in Khartoum. We're in the process of tying up with the governments of Oman and Seychelles as well. In all, Naruvi Hospitals is more than a hospital. It is an experience.
Good morning, everybody, and welcome to yet another edition of our 15-part Healthy India, Happy India webinar series. I'm Shoma Basu, Senior Deputy Editor with The Hindu, hosting the 13th edition today on gadgets in ENT. This webinar series is to promote health awareness, disease prevention, and overall wellness across the country and is jointly organized by the Naruvi Hospitals Vellore and the Hindu. We live in an era ruled by gadgets. A decade ago, in 2015, the World Health Organization warned that 1.1 billion young people are at risk of hearing loss due to usage of personal audio devices such as the smartphones, the earphones, the headphones, the Bluetooths, or even on hearing loud music and the noise created by industrial equipment. They all can damage our ear health. Our ears obviously are very delicate organs, and therefore there is a growing concern about the impact of modern technology and the workplace noise. We have a team of ENT specialists who, over the next hour, will discuss the early signs of ear damage, how it can be prevented, and what are the safe usage practices of these devices, which we often tend to overlook in our daily lives. I would like to invite Ms. Sadhana Chandrababu, advanced audiology practitioner with Powys Teaching Health Board, NHS, United Kingdom. Her talk will be on gadgets that cause hearing loss, the different risk factors associated with these gadgets, and how they trigger hearing loss. Ms. Sadhana was earlier working as senior audiologist with Naruvi Hospitals, Vellore, before she moved to the UK. She holds a master's degree in audiology and speech language pathology, along with other certifications from Singapore and UK. A certified tinnitus specialist from the National University of Singapore, Ms. Sadhana brings a wealth of expertise in diagnostic audiology, oral rehabilitation, tinnitus management, and vestibular assessment. She has also contributed to multidisciplinary team in NHS and private sector in setting up tinnitus service. In recognition of her clinical excellence, Ms. Sadhana was presented with the Service from the Heart Award by the KK Women and Children's Hospital, Singapore in 2020. Ms. Sadhana actively presents papers in workshops and conferences on topics across audiology field and is member of international audiology and healthcare organizations such as the Academy for Healthcare Science and British Academy of Audiology. Welcome, ma'am, and we are keen to hear you talk on this all-important topic of how gadgets can trigger hearing loss.
Thank you very much, Mrs. Soma Basu. I really appreciate this effort and giving me this opportunity to speak on this platform. We're very happy to bring all the knowledge to our common people out there and to be able to answer their queries. Now, moving on to my presentation. I hope you're able to see my screen.
Yes, ma'am.
Lovely. So today we are going to discuss about the gadgets in ENT, ear, nose, and throat specialty. What are the gadgets that could possibly cause hearing loss, and how do these gadgets cause hearing loss? But we will begin with how we are able to hear, the mechanism of hearing, what are the gadgets that cause hearing loss, and how these gadgets cause hearing loss, and any other precautionary measures that can be carried on with it. And my doctors, Dr. Vikram and Dr. Mary Kurian, they will be covering the noise-induced hearing loss and the preventative measures and risk factors and so on. Moving forward, so like I mentioned before, we will first understand how we hear through our ears and what are the gadgets that cause the hearing loss, how these hearing loss can occur with gadget exposure, What are the risk factors to consider when we discuss hearing loss caused by gadgets? And how do we compare the loudness levels of different gadget exposure? So the ear has three main parts. The sound waves, they pass through the outer ear and they cause the eardrum to vibrate. The eardrum and the three small bones that we see here, which is the malleus, incus, and stapes, this is stimulated and they travel to the inner ear. The vibrations then pass through the fluid in a small shaped part of the inner ear known as the cochlea. Cochlea is typically called the organ of hearing. Now, attached to these nerve cells in the cochlea are thousands of tiny hair cells that help turn the sound vibrations into electrical signals. Now, these electrical signals are then transmitted to the brain, and that is how we process the mechanical energy or the electrical energy into a sound wave energy and heard through the brain. Moving forward, I would like to play this video and I will explain what is going on in here. So we hear sounds through a remarkable chain of anatomical events that begins the moment the vibrations in the air enter our outer ear. Now, these vibrations travel down the ear canal and strike the eardrum, causing it to vibrate. These vibrations are then transmitted to the three smallest bones in the human body, the malleus, the incus, and the stapes. These bones amplify the sound and send it into the fluid-filled cochlea in the inner ear, where the real magic happens. Inside the cochlea are thousands of hair cells that bend with the movement of the fluid. Now, each bending hair cell converts this mechanical energy into electrical signals that are then transmitted via the auditory nerve directly to the brain. The brain interprets these signals as sound. So every whisper, a crash, or a song, basically any sound that we hear, this is how it's transmitted and caused to the brain. Now, this entire process, it unfolds in milliseconds, and it yet allows us to sense danger, understand speech, and even feel emotion through music. So hearing is not just a sense, it is an intricate symphony of anatomy and electricity. Now, what are the gadgets that cause hearing loss? The major gadgets, I've just put it on here, which is the earphones and the headphones. The earphones are the ones that come with the wired ones, whereas the headphones would be the over the head headphones, or the AirPods and the more modern digital electrical gadgets that we have at the moment. Most of these Bluetooth headphones will fall under this category. Next, we have the telephone or the mobile phone. It's usually the mobile phones now, and the loudspeakers, television, gun firing and aircraft noises, heavy machinery noise like the chainsaws, mowers, which are used in carpentry and even for gardening purposes in our regular day-to-day lives, tractors, which could be a major factor to consider for farmers. Then comes the factory or industrial noise-induced hearing loss, which will be covered by Dr. Vikram. And moving on, I've added on a little bit of information about the use of cotton buds, because the majority of our population, we use cotton buds to clean our ears. Despite cotton buds not being a gadget, we thought it was important to include this so the common people can benefit better with this knowledge. So moving forward, now how do these gadgets cause hearing loss? Now that we know how the hearing mechanism works, how do these gadgets cause hearing loss? Ideally, like I mentioned before, we have the tiny hair cells in the cochlea of the inner ear. Now, as these sounds pass inside your ears, when it reaches a certain level, let's say about 80 decibels, so sound is measured in decibels. Decibels is the unit measurement of sound. So as the sound volume increases, the loud noise can cause wear and tear of the hair cells or the nerve cells in the cochlea. Now, the more louder the sound, the more damage it causes to the hair cells in the cochlea. There are thousands and thousands of hair cells. So as the hair cells are more exposed to these loud sounds, they slowly weaken and die at a certain stage. Now, each of these hair cells, they are stimulated at different frequencies. So the low frequencies, the mid frequencies, and the high frequencies. A lot more about this would be discussed by Dr. Mary Kurian. So now damaged or missing hair cells, they don't send the electrical signals very well to the brain, which is what causes the hearing loss. Now, ideally, the headphones emit 85 to 100 decibels of maximum sound. So I'm talking about the maximum sound. Let's say we hear the headphones at about 50 decibels, but if you listen to these headphones at the same 50 decibels, although it is not the maximum level of sound, the time period of listening to music or loud sounds also can cause damage to the hair cells. Even the most ordinary headphones today, they emit an average of 85 to 100 decibels of maximum sound. Now, some of these personal listening devices, they're also kitted out with noise cancellation technology, which basically encloses your ears and it cuts off any external surrounding noise, which could cause a further deterioration of damage to your ears. Now, a recent study published in the journal Noise and Health in 2017, they suggested that those who use headphones at 90 to 100 decibels regularly and for prolonged periods of time had the greatest risk of developing hearing loss due to cochlear damage and tinnitus. There is still an ongoing debate of how the cell phone causes hearing loss due to radiation. Now, how else do gadgets cause hearing loss? Apart from causing damage to the inner hair cells in the cochlea, it can also rupture your eardrum, also known as the tympanic membrane perforation, especially if there's a sudden blast of noise, a bomb blast, or if there's a sudden gun firing, or any loud blast of noise, any sudden changes in pressure, or if you use the cotton buds to poke your eardrum, which I will talk to you about in a bit, with an object, or infection can also cause the eardrum to burst. Now, with prolonged use of headphones or earphones, there's an increase in temperature and humidity within the ear canal, and it causes a growth of bacteria and microbes that could also possibly cause an infection. Now, earphones with hard earbuds like our AirPods Pro or any modern digital AirPods, they could cause scratches or cuts or abrasions inside the ear, and this may also cause an infection. Now, everyone's skin sensitivity would differ. So if you are someone who has a very sensitive skin, especially around your ear area, then please look out for these factors to avoid causing any infection to your ears. Why shouldn't we use cotton buds in our ears? So like I mentioned before, depending on how delicate your skin is, it can damage the delicate skin of your ear canal, increasing the likelihood of infection. It may cause temporary hearing loss, earache, or tinnitus. Tinnitus is basically nothing but a ringing sensation in your ears. The cause of tinnitus varies from person to person, and there are certain management strategies to manage tinnitus as well. There's also a high risk of cotton bud puncturing the eardrum. Now, when you have a punctured eardrum, it could cause an infection, it could cause hearing loss, which is temporary or permanent. So you may need to see an ENT specialist to rule this out further. So I'd like to play a quick video just to describe how using a cotton bud would push the wax inside your eardrum, causing it to puncture. So when we try to remove the earwax using the cotton bud, unintentionally and subconsciously, we are actually pushing the wax deep inside the ear canal. So as you keep pushing it deeper and deeper, there is a high chance that it may feel impossible to remove the wax out yourself, which would cause a blocked hearing sensation or a temporary hearing loss. And there is a high chance that the earbud might reach your eardrum and also puncture your eardrum. It might cause a hole in your eardrum. Now, what are the risk factors we need to consider when we use gadgets that could possibly cause hearing loss. The first factor is aging. Now, as we age, irrespective of whether we use gadgets or not, our hair cells in the cochlea, they weaken and weaken and weaken. Just like any other organ in our body, our hair cells also weaken, which could cause a permanent hearing loss, which is usually seen much later in life. So these hair cells, they wear out over time, reducing the sound detection. But this typically usually begins at the high frequencies, which is the high pitch sounds, which is the female voices or the bird sounds, or any high pitch sounds like the alarms and things like that. It slowly deteriorates towards the mid and the low frequencies. Now, this makes it more susceptible to noise induced hearing loss. So if your hair cells are already weakened over time with aging, you are more prone to noise induced hearing loss. The other factor could be heredity as well. Your genes can also make it more likely to have ear damage from sound or from aging. Loud noise, like we spoke about now, the more louder the sound, the more damaging it is to your inner ear. Like I said, it doesn't necessarily mean just being exposed to rare intervals of loud sounds. It could also be prolonged intervals of a moderate sound level. Occupational noise exposure, jobs where the loud noise is constant, such as farming or factory, especially workers at the factories, it can lead to further damage inside the ear. Noise exposure at play. There are certain hobbies followed by a common people. Exposure to explosive noise like firearms, like gunshots, jet engines, these can cause immediate or permanent hearing loss. And also activities include snowmobiling, motorcycling, carpentry, and listening to loud music. I've just listed out the common sounds and their decibel levels. We don't necessarily need to remember the numbers, but this is just an initiative to make the public aware at what levels they might actually be listening at the moment subconsciously. So if you look at this, the refrigerator, which is at our home, it actually operates at a 40 decibel level. And the normal conversation which we converse at is at a 60 decibel level. So this is almost at a safe range. But moving on to the risk range is anything about 80 or 85 decibels and above. Heavy city traffic, school cafeteria, motorcycling, listening to music on full volume, especially using the Bluetooth headphones, which blocks out the noise cancellation. Chainsawers, if you're someone who frequently attends, especially the youngsters who frequently attend rock concerts or any music festival concerts, it's important to not be very close to the loudspeakers, that this may cause a further damage to your hearing. There are some of my patients who've questioned, I've been exposed to loud music throughout my throughout my young age, but I never had hearing loss when I was young. But they are probably 50 plus or 60 plus now, and they're experiencing hearing loss. The common question is, why are we experiencing it now? And why was our hearing all right when we were young, when we were actually exposed to the heavy noise? So ideally, you may not see an immediate effect of hearing loss as soon as you've heard the loud noise. It usually takes a while for it to be effective, for you to notice a change in your hearing. So it's usually noted much later in life. So these are more like precautionary measures, which Dr. Mary Ma'am would talk about. Sandblasting, ambulance sirens, firecracker, and firearms. So these are the common sounds and their decibel levels and what to look out for in our daily life, because subconsciously we are exposed to these sounds when we are in traffic, when we are in metro, when we're using our mobiles for longer duration at a high volume, when you listen to loud music at a high volume. So any volume above 80 decibels or more is injurious to your hearing health. Thank you very much. I hope this was informative. And now I'd like to end my presentation. Thank you.
Thank you, Ms. Sadhna, for that very interesting and detailed presentation. We will move on to our second speaker, Dr. Major Vikram M. who is a consultant in the ENT department at Naruvi, Vellore. After completing his undergraduation in 2005 from Jawaharlal Nehru Medical College, Belgaum, Dr. Vikram served in the Indian Army till 2013, during when he was selected to the elite special forces. After completing his tenure in the army, he joined the Command Hospital Air Force in Bengaluru to obtain a master's degree. Later, Dr. Vikram did fellowship in rhinology and skull base from Christian Medical College, Vellore, and worked for some time as faculty in CMC. 5 years ago, he joined the Naruvi hospitals in Vellore. His presentation is on noise-induced hearing loss in industrial workplaces. Over to you, Dr. Vikram.
Thanks a lot, ma'am. I'll be speaking mainly on the occupational noise-induced hearing loss. I hope you're able to see my screen.
Not yet.
How about now, ma'am?
Yes, sir.
Screen.
Yeah, so I'll be mainly dealing with occupational noise-induced hearing loss. So as far as humanity is concerned, somewhere in the middle of 18th century, it was the first observed evidence of hearing loss that was primarily seen in US in some of the copper mines. Amongst the workers who were working in the copper mines, it was observed that these people, after a period of working for many years in these copper mines, were suffering from hearing loss. So this is the first observed evidence of hearing loss which is related to a particular occupation. Now every one of us would like to live in this kind of a setting, white sand, clean waters, um, with the birds chirping in the background, ruffling of leaves, and all that. But all of us, I'm sure, are living in these kind of environments where there is a lot of noise from the machines, vehicles, and surrounding things that are happening around us. So, how do we define this occupational noise induced hearing losses? It's a partial or a complete hearing loss in one or both ears as a result of one's employment. Now, there are studies which are done taking the general population. So, the prevalence of this hearing loss in the general population is around 6 to 26%. And there has been a study which has been done on the Indian Air Force personnel, which is roughly around 30% of the Indian Force personnel suffering from occupational noise induced hearing loss. Some of the industries have got very high incidence of noise induced hearing loss, something like construction, manufacturing, mining. All these industries have a very high incidence of hearing loss, along with agriculture, utility, transportation, industries, military personnel, and musicians. Now, how do we know what sound, how loud is too loud? If you take anything less than 70 dBs, decibels, is generally safe. Uh, a single very loud noise or a long or a repeated exposure to sounds more than 85 dBs can cause hearing loss, and the permitted exposure noise levels is 85 dBs for 8 hours in the workplace. Now, so this is an animation which shows the different noises that we are usually surrounded with. A whisper is around 30 dBs. A typical conversation that we have one to one is around 60 dBs. So a hair dryer, that sound which we are all familiar with, causes around 80 dBs. So beyond that, what we are seeing is the sound of a motorcycle, which is around 90 dBs. If you're listening to music at maximum volume, it is around 110 dBs. Um, a hospital siren, an ambulance siren is around 120 dB, and a jet aircraft is around 150 dB. So how do you realize that noise may be a problem in your workplace? You finish your work and you come back home, and still you're able to listen some ringing or humming sound in your ears, in even after the exposure to noise is over. Then you need to think that there is a problem at your workplace. To your colleague or a co-worker, even at an arm's distance, you need to shout, or you're experiencing temporary hearing loss even after leaving work. The initial symptoms are that you have a decreased clarity in perceived speech, either normal or telephonic conversation, or you need to increase the television volume, or you're experiencing tinnitus. So I'll give you an example, and just to show that, as you can see, this is an audiometry report of a patient, and this is just of yesterday. So just to reflect on the point that how common this is in our ENT practice. Now this is a lady who came to our OPD in her early 30s, who is a homemaker, and the complaint that she had was that when she's speaking on phone off late, maybe a couple of months, that she's finding little difficulty in understanding certain sounds, and she feels a little strange hearing to those sounds. That was her only complaint. And we did the basic audiology workup, that is audiometry. And typically you can see the one in the red is the right ear, and the one in the left is deflected in the this thing. So you can see at the level of 4 kilohertz there is a big dip in the hearing. So after seeing the audiology report, I casually asked her that, is there any noise exposure? Because since she was a homemaker, I didn't ask her before, but I specifically asked after seeing the audiology report, because it is classical for a noise induced hearing loss. So she is married to a person who owns sawmills, and they are a family who owns many sawmills in and around Velo. And she's been married for last 10 years, and the house is situated next to the sawmill. So she is obviously getting exposed continuously to a high degree of noise, which has caused this kind of hearing loss. Now, how do we detect this noise-induced hearing loss? Is first by taking a detailed medical history, conducting series of audiological tests, and a detailed assessment of noise exposure. Well, there are two things in this. There is something called as a temporary and a permanent threshold shift. Now, what is temporary? It's an exposure to intense sound, which can produce a temporary threshold shift, acute change in hearing sensitivity, which recovers over a period of time. This over a period of time can be minutes, hours to days, usually within less than 3 weeks of exposure. And a loss that doesn't recover to the pre-exposure levels is called a permanent threshold shift. Many people come and ask, like, what is the treatment? Now I have lost my hearing. Now, what is there any treatment? Is there any medicines, any tablets, any injections to bring back my hearing which I have lost? To be frank, the answer is that as of today we don't have any medications to reverse this hearing loss which has already happened. The way forward is that if the hearing loss is significant enough to cause disturbance in your day-to-day life, the only way out is to give you a good hearing aid. If the hearing aids are not working, then there is a surgical option also available, which is called the cochlear implant. And the main thing for like the patient that I described is emphasis on preventing any further hearing loss. If you look at workplaces, how do we prevent noise induced hearing loss? Like, for example, having available noise controls. Like, if you are seeing at this gentleman on the left, the the machine's windows are kept open. A simple thing to do is to keep the noise under control, is to keep your windows closed when you're working on heavy machinery. The second is like maintaining equipment, like ensuring correct machine lubrication in equipments like belt and bolts and motor performance, and replacing any broken, worn out, or misused parts that contribute to equipment noise. uh, in your workplace, whenever you get breaks or lunch breaks, have them in quiet areas. Avoid circumstances where the communication is affected by noise, and definitely use hearing protection. The general rules for prevention of noise induced hearing losses are engineering controls, like reducing or eliminating the source of noise, or changing materials, processes, or workplace layout. Administrative controls, like changing work practices, managing policies or worker behaviors. And personal hearing protection devices and hearing surveillance, monitoring the hearing levels of exposed workers. Some of the hearing protection devices that we use are the earmuffs. These provide good protection, which are reusables. You can easily wear them and remove them. Only thing is that the initial high cost, and in certain industries, it is uncomfortable to wear in hot environments. The other variety is the uh, earplugs, which are comfortable. Which the only issue is that these are disposable, and which are lowest in the initial price. The other varieties are the push-in earplugs, which are easy to wear, reusable. But the only thing is that you need to wear the correct size of these earplugs. Sometimes it can become uncomfortable after long periods of time. To conclude, what I say are that basically the noise induced hearing loss is a preventable thing, and by taking correct measures, it can be prevented at the right time. But once it reaches to a level where there is an irreversible hearing loss, the only solutions available as of now are the hearing aids and the implants. So earplugs are cheaper than hearing aids. So I would suggest that people do use them in their workplaces. So with that, I would conclude my presentation, ma'am.
Thank you, Dr. Vikram. Before we move on to our final speaker of the day, I would request our attendees to start posting their questions in the Q&A box, which is open for you now. Our last speaker, friends, Professor Mary Kurian, Senior Consultant and Head of Department of ENT at Naruvi Hospitals, Vellore, will throw light on how to identify the early symptoms of ENT-related problems and what precautions ought to be taken to prevent damage or deterioration to our hearing ability. Professor Kurian did her ENT postgraduate training from Christian Medical College, Vellore, and remained in its faculty for 3 decades, till her retirement as professor and head in 2015. The next 8 years, she worked at the Pondicherry Institute of Medical Sciences before shifting to Naruvi in 2023. A life member of Association of Otorhinolaryngologists of India, the Indian Academy of Otorhinolaryngology, Head and Neck Surgery, and the Neuro-Otology and the Equilibriometric Society of India, Professor Mary became the first Indian woman in 2020 to be conferred upon the international membership of the American Society of Pediatric Otolaryngology. Professor Mary Kurian has been the founder, coordinator, and program director of the first postdoctoral fellowship in pediatric ENT introduced in India in 2012 under the MGR Medical University, Tamil Nadu. She has also been the Assistant Program Director of Oman Medical ENT Specialty Board from 2012 to 2014. Professor Mercurian has been on several international traveling fellowships in endoscopic sinus surgery at universities of Graz, Austria, and Pennsylvania, USA, pediatric ENT at universities of Johns Hopkins and Stanford in the US, and the Great Ormond Street Hospital for Sick Children in London. Professor Kurian's special interest is in pediatric ENT and medical ethics. She has over 100 publications in peer-reviewed journals, few quoted in ENT PG textbooks, and has recently authored a chapter in competency-based undergraduate ENT textbook. She has been university undergraduate and postgraduate examiner since 1992, DNB examiner since 2002, and examiner for postdoctoral fellowship in pediatric ENT since 2012. Over to you, Dr. Mail.
Thank you very much, Som, for the introduction. My topic, the continuation of the topic we spoke, I am the concluding speaker, just to give you an overview of slides. Overview of the two concluding part of the talk. That is, how do we identify the problem and the precautions we need. Slide 1. Yes. My previous speakers talked how it could happen, and Vikram went on to specifically noise-induced hearing loss in the industries. But most of the problems we are speaking are noise, though earlier it was not identified. How we identify, it's important. We just need to listen to the people or the people around you or the youngsters, or look for signs. One don't need to be a doctor for that. That is the reason why we are going to speak. How do we identify? And what precautions can we take to avoid those what we are seeing? We can call it as the do's and don'ts. We already spoke of the noises. World around, maybe many, many years ago, we identified industrial, but then came the environmental. Then, of course, the device induced. They are personal devices, it started in a minor way, but it's gone on, and now our younger generations tend to use. We realized there is noise by it as well. I won't speak too much about it because Sadhana did mention, just to know that the canal skin wax is always produced. Why? To keep the skin a little moist. But skin all over our body have normal bacteria, which are the good ones. But problems occur when we are fitting something into the ear. It can be too long and used too long, or it can be badly fitting that it can cause injury, infection, and already wax built up. So this is one thing. I won't speak too much, that's all. But there is another problem. We tend to, the earbuds that these devices have, we tend to place it not so right. Just look at this. No, but many youngsters takes time to realize it is ill-fitting, then the right fit is this. But of course, these days we also have the Bluetooth, the one without wires. The size may not be right. So these are one reason it can cause. And already mentioned, it has to be clean. One tend to forget that aspect. And number 2, it should not be kept too long. Already the video has been shown why it should not be. Generally, not more than 1 or 2 hours of usage continues. Which of them? Youngsters do it? No. But of course, this insert earbuds, those factors have become a little less a problem now that we have the bone conduction headphones. So coming to the problems. As mentioned, that is one of the problems, but the invisible problem is, before I go on to it, you can see, already I mentioned, we are concentrating more on the young children, adolescents, teenagers, and young adults who we have realized it's a fashion to use the device, and many of them tune in list, podcast, phone conversation, music subplayed, very high. See, like already mentioned by the other two, when I am talking, my sound is as loud as it's the intensity of sound. It's 40 to 50 decibel. But if I talk louder, maybe 50. So that is how it's labeled. But what happens in the headphones? They're enjoying, they become louder and louder. It can go out to 94 to 110 level. In fact, one is reached 110. Imagine it's more than 100 times as intense as the 85. So it's not directly proportional. I will speak about it later. How do you realize they are listening very loud? If me as a standby or standing next to a person using headphones, if you can hear the lyrics of that headphone, definitely the voice is louder. That is the general way of measuring it. Actually, most of these devices which the youngsters use, WHO has recommended that there should be a default output. It has to be set at 70 or 85. And then they are mentioned in that as percentages. But you know what happened in US? This default is not activated. They say it's the parents and caregivers and users, it's their responsibility to turn on this default setting. So there is an issue there. Coming back, what is the major problem? You see, you already discussed it's hearing loss. Unfortunately, it takes too long for the patient to tell or the person to tell, oh, I can't hear well. But you can hear telltale marks of it. They can't understand words. They start asking the other person, please talk loudly, or they will increase the volume of the television. But what worse is, they might just slowly move away from social gathering and they become depressed. So it is truly an invisible disability. Far more is like tinnitus, already mentioned by the others. Tinnitus is a sound, feeling of, the person can hear sounds within their ear when there is no external stimuli, most of. Usually it is as ringing, commonly. Sometimes they say as roaring and buzzing, but as already told by the others, that is a very significant earlier sound. Something is wrong with the inner ear. I just show this table just to show you, and already mentioned earlier by the previous two speakers, just to say all the equipment as shown here. I just want to show the safe range. They say sound as loud as 75 decibel. Some textbooks also say 80. It's safe. And the risk range actually starts from more than 85 and more. But the problem is not just that. I just want you to look at this thing. If you're 75, you can go up to 8 hours duration. But look at the next one. If it is 95, the exposure safe is only 4 hours. And if it's 100, 2 hours. And if it's 105, 1 hour. 115, only 15 minutes. Why is that? This is based by the National Institute of Occupational Safety and Health in 2018. Why does that occur? It is because for every 3 decibel above 85, the safe listening time is halved. So you see, it is a very grave issue, the increasing. And actually, WHO has put the standards as 75 decibel is a safe listening level on a 8-hour working day. So already the previous speaker has spoken about hereditary and aging. Some definitely illness, like person with diabetes, blood pressure, abnormal cholesterol, or obesity. They also have a risk because the disease itself has already started. Uncontrolled disease have a tendency to start reducing blood flow to the inner ear. So you already have an inner ear aspect which is little diseased, and you have a loud sound to it. Or if you have infective illness which can affect the inner ear, like meningitis, measles, mumps, and then you have a noise or other induced hearing loss, it is even more, they are even more at risk to the injury. Now, there is also another risk, medicines. See, antibiotics like gentamicin, streptomycin, Viagra, certain cancer medicine, and of course, aspirin in high dose, and of course, and anti-malarial drugs like quinine and Lasix diuretics. These all also cause damage to the inner ear. So a person already on this may have a minor damage and a noise can worsen. And for aspirin, it's the high dose can cause tinnitus, and that is a red flag. And if the medicine is stopped or reduced, this tinnitus also does stop. So the tinnitus is a very important red flag for any inner ear problem. It could be inner ear problem to other causes or directly by the noise. Now coming to the protective. What are the safeties that one should practice? I think the previous speaker, Sadhana, did mention of the distance. Just looking at what sound, there are three factors for safe listening: sound, the loudness, the time, and the distance. Higher the sound, I already showed, less time to listen safely at that level, already explained by the chart. And if one need to reduce the effect of the high sound, like you're in a concert, if you're standing in front, very high sound, you cannot listen to full concert, but you distance yourself away from the concert, a little farther away, you have a chance to listen long. So these are very important for safe listening: loudness, time, and the distance from the source. I'm just putting this just to reinforce that. Next question is, okay, when should we go to a doctor and ask for a hearing test? Of course, when you're using a hearing, you must go when you have all the telltale or red flags like hearing loss or tinnitus. But generally, by age of 60, it's better to go have a hearing test like the audiogram which Dr. Vikram mentioned. Then, of course, every couple of years after that. But if you have any metabolic illness I've mentioned, best to do it earlier. Or when one person itself finds there is a change, loss of, or a change of hearing, loss of hearing, and also tinnitus noted. Now coming to the next, again, how do you protect? There is a rule, some of the audiologists do say, you follow the 60-60 rule. What is 60-60? Listen at not more than 60% volume of the device for a maximum of 60 minutes at a time, and then take a break. Listening break, we call it. The volume for most is set up. Some centers also say, some audiologists or some of them do say, you can set to 60 to 80 and not more than 60 to 90 minutes. That's taking a little longer, but the 60-60 rule is best to follow, and a little above it maybe. Now, what are the tips? See, if you want to use headphones, if between the two, one would say it is a earbud or a headphones, try to switch over to headphones or wear earbud in one ear and then switch over to the other. Try to change the timings so that the timings less and the local injury timings is also less. Next is you opt for devices, it does have some noise cancellation and good quality. Otherwise, what will happen is you're hearing noise and then you will tend to increase the volume. That is counterproductive. Many devices come with the noise reduction ratings. Higher the number, more noise reduction. So it's important what device you're using for your personal listening devices also. And whenever you get a personal listening device, try to activate the volume control as I mentioned. Lower the volume. Move away from the loud sound source again as I mentioned earlier. Now coming to the rest of the tips already mentioned by Vikram as hearing protected devices and whatever. It may not be just your workplace. If you have some special hobby which involves loud sounds and that also, and the protective device, you must choose and get it. Choose a good one, expensive, and maybe important for you for lifelong. In other places, it's good to use earmuffs, already mentioned. And you think only a workplace, but a lot of people use tools at home and you have a lawnmower equipment. There too, you must reduce the reduction and use fitting. And there is also special fitting for children. And in your home itself, if you have noisy appliances, it's good to use a pads under it and avoid using multiple simultaneous noisy appliances at the same time. Or also carpets can be used to absorb the sound. And if you are in a place with a lot of traffic noise, they say seal the windows and doors. That also reduce. These are all simple measures, but fairly important, cannot be ignored. Now, we always know the noise-induced hearing loss is becoming more and more a problem in our existence these days. Most of the reports are from the West, then we will think, oh, it's not a big problem in our country. No, this is one of the very recent journal which says there is a definite public health, occupational health there. They definitely reads advocacy for implementation of legislative for the occupational hazards in industry and the behavioral changes. Not just that, yet another recent journal has mentioned that this is a smartphone-based assessment among medical students that 9.4% of the applicants were likely to have hearing loss and 53% should be screened. So it is becoming more an issue in our own country. And one of the even later one just published last year, they did a study on unsafe personal listening device from South India. And there is saying there is a concerning lack of safety practices about noise-induced hearing loss among them as well. So it is here to stay. It is in our country. We all have to be aware of it for safe listening practices, especially the younger. So once I'm done, just for a take-home message, the best is limit usage time. Avoid hearing earbuds or headphones extended. You can say the 60-60. If at all you need to use, rotate the devices. You can use headphones once, insert once, or the other at different times. That is what they say. Probably listening time. These days you have a bone conduction headphones, which the ear is left open, so it is more preferable depending on what your occupation or it is used for leisure. Very important, activate volume control on a device and adjust the volume level to being fully aware of the 60-60 rule. Very important. Take breaks from listening. Again, the 60-60. Be mindful of the overall sound environment. So that is where the noise, so if there is a sound environment, and you want to hear better, you tend to raise the volume, but be mindful of that. Finally, don't forget, keep the device clean and practice ear hygiene. I think it's important to remember once again, lower than the normal 75 to 80 decibel can damage if the person has metabolic risk factors. Like already mentioned by previous speakers, research suggests actually residual long-term hearing damage can occur when exposed to impulse or continuous loud sound, in spite of a temporary hearing loss for 16 to 18 hours. You can say hearing compacts, but there will be some residual damage. Hearing loss is an invisible disability, unlike visual. And the one affected suffer in silence. It's better to be safe than sorry. My references have been from these. Thank you very much for your patient listening.
Thank you, Professor Mary. To all ENT specialists talk so softly. I almost was doubting my own hearing ability listening to you. So anyway, I think the three presentations have taken all our time of the program, but I'll quickly try to squeeze in a few questions from our audience. The most repeated question is about, I think, Ms. Sadhna, in your presentation, you mentioned cotton buds should not be used. So everybody wants to know, then how do we take care of ear hygiene at home if we can't use cotton buds?
Yes, thank you. So I think I predicted that question even before it arrived. So ideally, we do recommend to use olive oil in our ears so we can remove the earwax, we can soften the earwax, and the wax will be removed by itself naturally. Or the other option would just be to meet with an ENT consultant, and they will perform a microsuction procedure to remove the wax out.
You know, like if you go to rural interiors in northern India, you will find, you know, if anybody has any kind of earache or ear pain because of wax or anything else, people go to, maybe they are quacks who literally pour hot oil into your ear and they use tools to bring out all the dirt. And I have myself seen somebody taking out a cockroach out of somebody's ears. So, I mean, how do you, you know, kind of, I mean, when we talk about ear hygiene and all, we are all talking about our urban centers and we know what people are able to do. But what happens to these millions of people living in the interiors? I mean, how are their ears protected?
Can I answer the
please,
question?
Please, ma'am.
Yeah. See, the ear canal is actually not straight. Our ear canal is a little curved. That is nature's way of preventing anything going straight and here, damaging the eardrum. And number two, the skin in the eardrum, in the ear canal, normally the wax migrates out. It's a normal phenomenon. Little bit is formed and little comes out. There is a method of coming out. So nature has it in itself. Nobody need to clean the ears unless there is a pus coming from the ear. So what our people normally do is actually Johnson's buds. I know those days there was Johnson's bud given. Everyone sort of. That the minute you clean your ears, you're only reaching two things you're doing. Like Sadhana showed, you're pushing the wax in. Number two, the wax was actually the process of coming out. We have pushed in. Number two, you are stimulating wax secretions and that worsens. So these are the two it's best to avoid. But if there is wax collection, you have to soften it. Because as it remains there, it becomes hard. So the softening is by the villagers. We use oil. We can either use coconut oil, olive oil is for the Middle East, whatever oil, we tell them you boil and cool it so that it is sterile. Otherwise, we have drops. It's called wax or ear drops. We When we put it, it's soften. It's best to soften it 3 drops, 2-3 times a day for 3 days. Normally it comes out. Otherwise, go to an ENT who will suction it out. So you really need to tell. You don't need to clean inside your ears unless your ear is paining, itching, or pus is coming out, or it gives you pain.
So, look, all of you have given reasons what can cause hearing loss, but like how many episodes does it require to actually, because hearing loss must be progressive. So, like over the years, like, is there kind of a time span? Like, there are kids who are all the time having their headphones. They go to bed putting headphones and music. Then you find very small babies being taken in aircrafts where there is so much sound. Even adults get these earaches during landing and takeoff. So, like, basically, like how many episodes does it require for one to start getting some kind of indication that I could be having a problem in my ear?
Maybe I'll take that question, ma'am.
Please.
See, I'll just narrate you one small incident. We had an engineering student who came to me early in the morning at around 8 o'clock. We open our OPDs and he's sitting in a OPD saying that my ears feel a little strange. I said, what do you mean by strange? He feels that the whole world has become silent suddenly. So I asked, what happened last night? So he says, I accidentally wore my headphones and I went to sleep. Okay. So, as you asked a question, how long is the exposure? It's there's no specific time limit, but ma'am mentioned what is the safe exposure levels. But our genetic makeup, a person A, B, and C and D are different. You may find 100 workers working in the same place, but many of them retire with good hearing. Some of them with even 2 years of experience they start developing hearing. So our genetics make a big difference out of that. But in general, what is said, as ma'am said, is that if you're using any headphones, any if like you mentioned about a baby going to this thing, of course the exposure time is very small if you're getting exposed to a airline engine, jet engine or something like that. But even then, in such instances also, maintaining a safe distance from the source of noise as well as limiting the exposure time is most important, and advising anybody not to use headphones for more than 60 minutes, as ma'am mentioned, for in keeping it in 60% of volume. Now most of the devices don't give this thing in percentages. They just tell us that you're exceeding your maximum limit or safe limits and all that. So, a single exposure can also have been reported. We had patients who have come, like as I mentioned to you, that after a single exposure, prolonged exposure, they have come with profound hearing loss, which unfortunately we don't have a treatment to reverse it back. We had young people studying engineering and all coming to us with this thing, and then we just can't do anything once the hearing loss has set in. That is the truth.
What about the sound in movie theaters? People take their babies or even the senior citizens who sit through a 3-hour movie, with all these Dolby stereo sounds and things these days. So should they put some cotton balls in, especially if they carry their babies with them? Is that
Especially
advisable?
carrying a baby is not recommended
Not
on to a movie theater. First of all, this thing, and because of increasing the sound experience, nowadays they're coming with surround sound and all that, and especially if the ambient noise definitely is more than 90 dB. So the exposure time for senior citizens, it can be detrimental. It can reduce because they're already having as ma'am mentioned, once you're 60, most of us start experiencing hearing loss. So going to a movie theater, sitting there for 2.5 to 3 hours, surrounded by loud noises, can have a detrimental effect on their hearing. So I, I mean, I would say that best is to avoid these circumstances. But yes, if you are this thing, there are sound protectors that you can wear which are literally like soft, the ones that I showed you, the soft ones you can wear, which can reduce the noise by about 20 to 30 dB.
Yeah, would you like to add? Yeah.
No, I just wanted to, your first question, your first suggestion saying babies sometimes have hearing loss when they go up in the flight. The babies have a different issue. Agreed, age maybe whether it is hearing, but there is also hearing loss to fluid in the ears. What happens in children is many of them have a upper respiratory tract infection. So the ascent and descent causes some difference in the atmospheric pressure and things. Sometimes they can have some fluid in the ear, and that can cause. So that sometimes babies have pain and they cry. So that's one. So that usually we tell them if the baby has a cough or cold, we say use a nasal drops just before entering the flight and coming down, and hydrate the baby well. Usually that settles. That is one very common. We call it a barotrauma. That's a trauma by the change of pressure, and even adults can get if they have a upper respiratory tract infection. Generally, it settles. If it doesn't settle more than 24 hours, better to show an ENT.
So music is generally pleasing to hear. So, but somebody is asking, is there a difference, or what is the difference between noise-induced hearing loss and music-induced hearing loss? Would you like to take that, Ms. Sadhana?
So ideally, noise-induced hearing loss is, I would presume it's more louder than the music-induced hearing loss. So the music-induced hearing loss is up to us, how we set the volume, but noise-induced hearing loss is out of our control. So more often when you work in an industrial setup or when you're employed in a factory or so on, it's out of our control for how loud the noise can be. And we can use ear protective devices to control the noise-induced hearing loss. But with respect to music, it's under our control how we set the volume and how we listen to it. But otherwise, the damage that causes is the same damage. It still affects your ears, it still affects your hair cells, and it still deteriorates your hearing. If sir or ma'am would like to add in any more points.
Yeah, I think it's the loudness. Noise is actually sounds of different frequencies mixed up. It's just that music is good because anything becomes loud. It is noise. It's just a single band, another band. Music, it's a loud music. So that's what the youngsters has to be told. Music is good, but over the years, we are meant to hear music by our own hearing capacity. They have hearing capacity, but they want to listen loudly because it causes a dumb feeling. And it excludes surroundings. They are fully concentrated. That is when it becomes unnatural and a pathological level. That is the reason. It is a level before, way above what your body or your ears are made for. That is definitely harmful.
Dr. Vikram, what kind of industries are causing the maximum noise pollutions? And are we strictly following the laws with respect to occupational hearing loss?
As far as India is concerned, ma'am, the construction and manufacturing facilities, as I mentioned to you, sawmills, these are the industries which are bigger in number, I would say, and most of the unregulated industries. I mean, unregulated in the sense which are employing 10 people, 10 to 15 people, where you don't have health inspections going on. These are the places where you find that the regulations are not being followed. Bigger industries, well regulated industries, we do come across people who come for regular hearing checkups every 6 months. They are mandated to do health checkups. We get a lot of people, just they come for an audiometry, get their audiometries done every 6 months, and then we compare the previous audiometries and advise them accordingly. Okay, this was your last hearing this thing, and this is what it has been over a period of 6 months, 1 year, how it has been faring. And as far as to be on ground, whether whatever things we mentioned, like the exposure of noise levels and this thing, the loss, I don't think that, as far as ensuring the safety of the person concerned or the health checkups to the extent that happens in the Western world, it's not, I don't think the same happens in our country.
We all understand that overuse of these audio devices are not good, but there are a couple of questions. I'm just clubbing them because people want to know which is better of the worst, like the what do you call them, the earplugs, are they better, or the over the earphone headphones are better, or Bluetooth are better? Because people, even in their working conditions, are in situations where they are compelled to use these devices. So there are these couple of questions. I mean, each of them are separately asking which is a better device to use when you're forced to use.
Yeah, workplace. Actually, when they are at the workplace, they will use at what level? They are not going to use it very loudly. We already know it is definitely less than 75 decibel workplace. For them, probably they use headphones are good for work because it takes away the problem of something sitting in the ear canal. Because earplugs come with specific sizes. Some people it does not fit in. So for if it is workplace, best is headphones. And most workplace, we must say, put it at a 75 decibel or 60% volume, whatever it shows in your headphones. You must buy a good headphone if your workplace has got a lot of headphone usage. And 8 hours safe, it is safe, so they don't need to worry. If at all you have both of it, you prefer an insert headphone better than the headphone, then you have to rotate the two. So it is rotation. If it is, this definitely needs time. Headphone is best. But what happens is in youngsters who are for recreational music, headphones, insert, you tend to use it more and more headphones. But then again, the volume has to be set very conscious. And best to have the 60/60 for them. So the headphones are long-term use, it is headphones. That's what has been recommended, but it is individual. But now we have something called the bone conduction headphones. That's the one I showed, the third picture, which comes as a band. It's a very good one. That is actually, you hear the outside sounds also. Many prefer those. And very good ones are useful. So that takes away not listening, not hearing what is happening outside something, but your hearing is very well fitting one. You can hear very well. And the injury by local earbud headphones are not there. So it's the loudness that is very, very important setting.
And of course, again, there are questions about the risk of infections of using these devices. And you have mentioned in your presentation that one has to, kind of, I think, sanitize also the
Yes,
devices.
even the earbud tips have to be kept clean. Otherwise, there's a normal flora in our ear. And that is why they say the listening time break it. Because you get time for that area, the ear to get a little dry, breathe. It's a closed space, isn't it? So, other than the
Then there
noise.
are, Then there are multiple questions on people want to know in layman's term, what is the ideal volume at which people should listen to whatever they are listening.
Our normal a whisper is about 30 decibel, a whisper. Conversation, they say, I think Sadhana said up to 60, 45 to 50. And then over that is a shout, 75. I don't know whether anyone can shout more than 75. I don't know. Sadhana, you'll be able to tell that?
I think, just like ma'am mentioned, 40 to 50 decibels would be normal conversation. And we ideally don't tend to shout as much, but yeah, so I think above 60, 65 decibels would be a shout. Yeah.
Basically, ma'am, if you are listening to music and if you're not able to hear somebody talk to you when you're listening to music, you're listening at a high volume.
That's correct. Very good.
So ambient noise is very important. The surrounding noise is very important. It dampens the sound that is entering the eardrum. So ambient noise is good. Nowadays we are getting these zero noise and all these concepts which are coming in. It is a very excellent experience, but then it is cutting out all the ambient noise. So for example, I'm sitting in this room, there is AC, there is some sound that is surrounding me. What happens is when you insert your this thing, the all the ambient noise is gone, so the exposure to the eardrum is direct, and the effect of that also is more when you have this thing. So if your workplace, if you have a separate chamber and there are meetings, if you can use Bluetooth speakers like the way we are doing now on Zoom, if you are able to many places, many managerial posts will have separate chambers. I'm sure many will be working having a common workplace, but I'm talking to people like if you are working from home and if you have a space dedicated to yourself, in those circumstances at least use Bluetooth speakers, wireless Bluetooth or wired Bluetooth speakers. Get the sound from that so that you have an ambient sound surrounding you. Yes, the clarity of sound may not be that great, but in those circumstances at least you can avoid the damage that can happen to your ears.
Yeah, the bone conduction headphones are very good. The reason, bone conduction headphones. It does not cut off the ambient noise. There are various prices for it. It's available online, but to ask the audiologist for specifications before go on it, I may not be. Sadhana, you'd be able to say.
Yes,
So,
ma'am.
like you said, ambient noise must be there. It is correct.
Yes, ma'am. But they do say that there's no enough evidence of research supporting that when we use Bluetooth headphones, it causes more damage than the regular headphones. The research is still going on. But the ideology behind that for the research is that if the radiation from the Bluetooth causes any further damage than the wired headphones that don't have any radiation or close proximity to the eardrum. But like ma'am mentioned, the bone anchored hearing
Bone,
device would be a more suitable device than the regular headphones, or the placement of the regular headphones should most likely be placed different than how we usually place them.
yeah.
Then
The
again, there
bone
are a lot.
conduction is at the cheekbone.
There are quite a few questions where people have cited their specific problems. I'll just take one where Mr. Ari Valagam says that my wife, who's aged 55 years, she complains about ear blocking for a couple of hours in the morning alone. And this has been happening for the past 3 months. They have consulted ENT doctors, but no specific problem has been found. So, what does it indicate, and how do they proceed further?
Does she have any nasal symptoms?
No, he's only written this much, ma'am.
Yes,
I just read out
morning.
what he has written.
Yeah, what happens is sometimes in the morning you have some blocked ears. Sometimes if they have an allergic symptoms, which is more in the night, the ear and nose are connected by the eustachian tubes. Sometimes congestion in the nose can cause early morning block sensation, which as day go by. Isn't it anything else, Vikram and Sadhana?
Just drink lots of warm
Ah,
water at night and
yeah.
you'll be fine in the morning.
So that's why it's very difficult just with one symptom.
Basically, the change in temperatures, ma'am. When you wake up, the temperature outside is cold. So the eustachian tube, which regulates the pressure between the back of the nose and the ear, tends to get blocked in the colder temperatures. So in such people, what do we advise is before going to bed, have a good glass of hot to warm water, and morning also again repeat the same thing. So every time you swallow, the eustachian tube, which is in the back of the nose, keeps opening. It's the same thing what happens in when you're flying and landing, the pressure regulating thing. So that helps to keep the ear open. Some people do have problems with the eustachian tube thing, which typically have this history of having blocked sensation early in the morning.
So I'm really, really sorry. I have to wind up the session now. And I really thank all of you for sparing your time on Sunday morning to join our webinar on gadgets in ENT, a part of 15 Editions initiative under the Happy India, Healthy India initiative presented by the Naruvi Hospitals in association with the Hindu. Thank you once again, Dr. Kurian, Dr. Vikram, and Ms. Sadhana, and to all our attendees who have sent in actually quite a few questions, and they made the program more lively. Thank you all once again.
Thank you very much. Have a good week ahead.
Thank you.
Thank you, ma'am.